Hello, Namaskar. Good evening, everyone. Welcome to our FIR Weekly Talk with an Expert series. I am Dr. Dravya Jain, your host, and I welcome you all today. For today's discussion, we focus on our well being. It is not uncommon to see that stress can easily become a part of our lives. Not only does it affect us mentally, there can be manifestations of stress on physical health as well. It becomes a vicious cycle when that stress reflects in our confidence and again can affect our mental health. Before we start our discussion for today, I would like to introduce Federation of Indian Industry and our expert for today. Federation of Indian Industry is a not-for-profit organization. It is an advisory interface between the government and industries. FII offers a platform for networking and relationship building within and across the industrial sectors, policy makers, and the international business fraternity. Our Director General, Shri Deepak Jain, he's an industrialist, economic policies advisor, philanthropist, and a writer. He is also the national working president of Digambar Jain Mahasamiti. He has several papers and policy documents to his credit, which include Economic Vision Document for BJP, several papers on economics for Government of India, working papers on Yamuna Action Plan, Plan for Gold Bond Scheme, to name a few. I would also like to introduce our guest expert for today, Dr. Shalini Malhotra. Welcome, Dr. Malhotra. Before we proceed with the questions, I would like to introduce Dr. Malhotra's profile with all of us. Dr. Shalini Malhotra is a consultant dermatologist and an American board certified hair transplant surgeon. She has exclusively worked in the field of hair restoration for over 10 years. Her clientele includes bureaucrats, politicians, artists, judges, and other well known achievers in their fields, and she has performed over 3,500 successful surgeries to date. She is the first Indian to be appointed to the board of directors of the American Board of Hair Restoration Surgery, which is the only board certifying hair transplant surgeons worldwide. She was also awarded the Best Young Dermatologist Award at the annual Cuticon of the Indian Association of Dermatologists, Venerologists, and Leprologists held in 2009. She was also invited as a speaker on multiple honorable platforms. And I welcome you, Dr. Malhotra, today. Thank you so much for being with us. I have shared your profile with all of us, but I would request you to give a brief introduction about who you are really as a person. Our audience would like to know the real person behind this profile.
Thank you, Dr. Dravya, for such a generous introduction. And I would like to thank Dr. Deepak Jain, the whole fraternity of FII, for having me here today. It's an honor, it's a privilege to be here to speaking to such an elite audience today. Well, as a person, I'm a very simple person who believes in loving your profession. And I have been fortunate enough to be in a profession where I have not had a day of regret. I'm basically a dermatologist. I graduated from Safdarjung Hospital, New Delhi. And after that, hair transplant happened to me by chance. Um, uh, my profile was on Naukri.com, and this particular company, which is a European chain of company which has hair transplant centers world over, they contacted me based on my profile. And even before I could clear my postgraduate exam, they offered me a job there. And what I really liked about the job was that I had to travel a lot to various cities and to perform the surgery. It was like a job of a flying doctor. So I just took it up for my love for travel. But eventually, when I started operating and learning hair transplant, I eventually fell in love with my profession also. It was like an arranged marriage. Initially, everything looks good. You get involved with it, and then you gradually fall in love with it. So then I've been fortunate enough to, be in this profession. And because I enjoy my profession, I think that is one of the biggest reasons that I have excelled in this field. So that is it.
Wonderful, wonderful. I think that's really inspiring. I mean, once you start loving your work, it does not feel like work anymore.
It doesn't feel like a burden, and I think then you can give your best and you can actually reach heights which nobody can imagine. If there is no love for your profession, frustration builds up, and then you eventually, I don't think you achieve what you can achieve in such a scenario.
Right, right. So, Dr. Malhotra, it's not very, as I introduced our session for today, it's not very uncommon to see that stress can really manifest in any size and shape and form, mentally, physically, emotionally. And it's also not very uncommon to see that people as young as, in their 30s, especially, our young entrepreneurs, industrialists, um, it's the last COVID period especially has been very stressful for them. So there have been, it sort of affects your confidence, when it reflects on your um, how you look, how you present yourself, the confidence. What are your thoughts about it?
I totally agree with you. Well, as the proper saying goes, your skin is a reflection of your inner state of being. I would like to add to it, your skin as well as your hair is a reflection of your inner state of being. Stress not only affects the way your skin looks, it also affects the way your hair your hair fall starts to happen, your hair become lustreless, and needless to say, when it comes to your skin loses its glow, its sheen, dark circles happen, and people can look at you and make out that something is not correct. So, to have a glowing skin and a healthy skin, it's very important to be stress free. Stress is related to other things. If you are stressed up, you do not have proper diet, you do not have proper sleep. Now, a good diet and a good sleep is also sine qua non for a healthy appearing skin and healthy lustrous hair. So it's all interrelated. So stress management is one of the most important thing that one should pursue to have a glowing, healthy, and a beautiful skin and hair.
राइट सो इट्स वेरी मतलब हमारे साथ हेयर फॉल स्टार्ट होता है, हमारी स्किन में कुछ इश्यूज आते हैं, हम डर्मेटोलॉजिस्ट के पास तो जाते हैं ट्रीटमेंट के लिए, पर आई थिंक वी सेल्डम ओनली लुक एट दिस एस्पेक्ट कि ये हो क्यों रहा है, अंडरलाइन प्रॉब्लम्स क्या है. सो hair loss and these skin problems, can they solely be also because of stress? Can stress like play a major role in aggravating these things?
Okay, so before I go into the causes, let me just talk about what is normal hair loss. So, if you're having about 80 to 100 strands of hair loss every day in the wash basin or on the on the pillow cover, if you see hair which is about this much, it is absolutely fine. So you don't actually count it, but yeah, just an approximate this much of hair is um, is normal. But if the hair fall exceeds 100 strands a day, then yes, you should consult your dermatologist. Just to mention few general causes which lead to hair loss. First and foremost, as you already mentioned, stress. It's very important. It's a major cause for hair loss and your dull skin. Let's talk of other causes. Well, decreased hemoglobin. If you're anemic, you're not having proper diet rich in iron, then you can experience hair loss. It can happen if you're having some certain thyroid abnormalities. Hypothyroidism or hyperthyroidism can lead to hair loss. Some nutrient deficiency, like vitamin D deficiency, like calcium deficiency, can lead to hair loss. If you undergo repeated treatments on your hair, like keratin treatment, smoothing, excessive blow drying of your hair, that can also lead to hair loss. Using shampoos and products which are rich in chemicals, which give you instant smoothing effect, but definitely there are certain chemicals which are harsh, which are added to these shampoos and conditioner, that can lead to, eventually that can lead to hair loss. Pregnancy, or major illnesses like typhoid. These events in life are followed by hair loss, which of course is reversible. Pregnancy, post pregnancy for about an year or two, a lady can experience hair loss, which eventually stops. Post typhoid, post COVID, people can have hair loss, but that also eventually reverses in about an year and a half. Apart from this, a very, very important cause for hair loss is genetic baldness, which is also known as, in medical terminology, androgenetic alopecia. If a person is having baldness in the family, like your father's side or your mother's side, not in your immediate relatives, Maybe in your extended relatives, that like your four grandfathers, or even before that, if
Right.
somebody was bald, that gene can manifest in you. In such a case, well, you have to understand that nothing but a hair transplant procedure can get your hair back.
ओके, एक
Then of
जनरल
course there is,
क्वेश्चन मैं और पहले
yes,
पूछना चाहूँगी। फॉर एग्जांपल जैसे हम किसी को भी नया एक बॉल्डिंग पैटर्न या एक पैच दिखने लगता है, तो हाउ कैन वन अप्रोच दिस? डर्मेटोलॉजिस्ट के पास जाते हुए भी उनको क्या चीज़ों का एक ध्यान रखना चाहिए? इसको कैसे अप्रोच करना चाहिए इस पूरी सिचुएशन को?
देखिए, अगर आपको अपने बालों में, आपको स्कैल्प पे बॉल्डिंग नजर आ रही है, सबसे पहली चीज, घबराए नहीं। क्योंकि कई लोग इस चीज को लेके बहुत स्ट्रेस लेते हैं, कुछ डॉक्टर के पास भी नहीं जाते, बस घर बैठ के अपने बालों को शीशे में देखकर स्ट्रेस लेते रहते हैं। अगेन इट्स अ विशियस साइकिल। यू टेक स्ट्रेस, यू हैव मोर हेयर फॉल, यू टेक मोर स्ट्रेस, मोर हेयर फॉल, ब्रेक द साइकिल। स्टॉप टेकिंग
राइट।
स्ट्रेस अबाउट इट, एवरीथिंग हैज अ solution. Okay. Visit your dermatologist, discuss with her or him your problem, and then, as per their advice, you can go ahead with it without any preformed notions and without any preformed opinions due to excessive googling about hair loss. Go meet your doctor and just follow their advice. You will be fine.
तो जैसे कई केसेस में किसी की फैमिली हिस्ट्री है ऑफ जेनेटिक बॉल्डिंग, तो व्हाट आर द पॉसिबल ऑप्शंस ऑफ ट्रीटमेंट फॉर दैट पर्सन? क्या इज इट रिवर्सिबल, इज इट इरिवर्सिबल?
Okay. So, when it comes to genetic baldness, first of all, you need to understand that not only men, but even women suffer from genetic baldness. The mode of presentation is different. In a man, जब एक मेल पर्सन बॉल्डनेस के साथ आता है, तो उसका एक वेल डिफाइंड एरिया होता है बॉल्डनेस का, हेयरलाइन नहीं होती है, यहाँ पूरा बॉल्ड एरिया होगा। लेकिन जब एक लेडी आएगी, जब एक लेडी को जेनेटिक बॉल्डनेस होता है, देन व्हाट यू कैन सी, देयर इज नो वेल डिफाइंड एरिया, but there is thinning along the parting in this area in the center, or at a round area patch here, which can occur due to some hormonal changes, as well as post menopause, but predominantly it happens due to genes. Well, in such a case, you have to contemplate a hair transplant. Hair transplant is the only procedure that can restore the lost roots on your scalp. So that's a very simple procedure. We simply take out hair from the healthy area of your back one by one, and we implant it in the bald area one by one. This procedure is done under local anesthesia. You are conscious. We listen to music in the OT. We have regular breaks. We have tea, coffee breaks. We chit chat, and you don't even know, when the procedure is over. You can go home the same day. You can resume your normal activities from the next day, though your results will take about 7 to 9 months to show fully. But this is the only option you have, and this is the best option you have. And don't get disheartened if you are bald. You should go ahead with a hair transplant and just get the area filled up and get your hair back. So a simple slogan where I used to work earlier was, get your hair back and feel the wind in your hair. Just imagine, you don't have wind, you have ball, and then you get your hair back. You can feel the hair flying, and you
Yeah.
can style it. It's a beautiful feeling. And even for women, please understand this, and I want all of you to be aware that if you have thinning, there is a very beautiful option in the form of hair transplant. And we do not shave women. Generally the notion is, if you go for a hair transplant, you have to get fully bald, and then you undergo the procedure. But for women, we do unshaven sessions where we do not shave you at all. Nobody will come to know that you have undergone a hair transplant. They will just see the difference.
One thing I would like to point out to the audience is this procedure, as Dr. Malhotra just explained, it's painless. So
Yes.
any apprehensions regarding the treatment, that it will be painful, yeah, swelling hoga, yeah, XYZ post treatment symptoms, those are not there since it's done under
Yeah.
local anesthesia.
Yeah, so there are a couple of techniques of hair transplant. In some techniques, there are stitches which are given at the back. In that case, you may have pain, but the technique what we do, and which people are opting for world over, is FUE technique, where there are no stitches, there are no scarring, incision, or any bleeding per se. We simply pluck out hair from the back and simply implant. Yes, it is painless. We do it under local anesthesia. So initial 3 to 4 minutes, you feel the injection of some small, you feel the pain of few small injections, and after that it is painless. There are no side effects. There is no swelling in our technique. And as I already said, you can resume your routine activities from the next day. What could be better than this?
Right, right. So we talked about the genetic baldness that is there. जिन लोगों में जेनेटिक नहीं होती या मे बी इट मे बी बिकॉज ऑफ द इन्वायरमेंटल फैक्टर्स, स्ट्रेस हो गया, लाइफस्टाइल वैसा हो गया, या प्रॉपर केयर नहीं डिवोट कर पा रहे हैं, उन केसेस में व्हाट आर द ट्रीटमेंट ऑप्शंस एंड व्हाट हाउ कैन वन अप्रोच दिस?
See, you have to. There is no other way to approach this rather other than starting to take care of your skin and hair. Rest of the other things will fall in place. But if you don't take care of your health, your body, then I don't think anything else is worth it. So you should have good diet. Number one, have a diet rich in roughage so that your bowels are clear every morning. You are not constipated. Have diet rich in proteins. Proteins form keratin. Keratin is the protective layer of the shaft of your hair on your scalp. So have diet rich in proteins. Have lots of water, fresh fruits, vegetables. Keep your hemoglobin levels high. So have iron rich food. Have dates, guava, they are rich in calcium. So calcium is the important matrix, is the important ingredient of ingredient which gives strength to your hair shaft. So have proper diet rich in calcium. For your skin, one piece of advice I would like to give everybody, that is use sunscreen. सनस्क्रीन इज लाइक अ रामबाण. अगर आपने सनस्क्रीन लगा लिया, आपकी स्किन की एजिंग भी डिले होगी, आपकी स्किन का ग्लो भी मेंटेन रहेगा, टैनिंग भी नहीं होगी. सनस्क्रीन आपको एवरी मॉर्निंग लगाना है एट अराउंड 9 a.m. एंड एट अराउंड 11 or 12 p.m. 11 a.m. or 12 p.m. Just like you have your breakfast in the morning, just apply sunscreen. Even if you are indoors, apply sunscreen. There are UV rays in the tubes and the bulbs of our house that can also eventually, over a period of time, cause damage to our skin. Sunscreen is a must, and a good diet. That is what I would suggest.
All right, all
And
right.
of course, a lifestyle, where you do yoga regularly, you do pranayam regularly. These are important to manage your stress, and to maintain a good health and a good weight. So everything is important, in a constellation.
Right. We talked about hair and diet and lifestyle. Um, One thing that is also very common is acne during teenage. And I
Yes.
remember our parents used to be so worried all the time, and so conscious for us, and that sort of, I think, reflects in the teenagers confidence as well. When their skin is breaking out, they're in school, they are in public speaking platforms and everything. So what is the right way to deal with this phase?
Okay, so yes, having acne during teenage can be a harrowing experience because children are very conscious about their looks at that time. They are exploring themselves, and then you have these acne on your face. So, they first of all you have to understand it is most of the times it is due to hormonal changes which are occurring in the body of people who have just of children who have just entered their teenage. You have to counsel them that this will settle down. Okay, this will not stay with them forever. This is just due to some hormonal changes. They should be advised not to prick the acne. The impulse is to break the acne and squeeze the pus out. Generally, when this is done during teenage or during early stages of life, it leaves scars on your face, like pitted scars or some pigmented scars on your face. So they should not touch the acne. They should, before sleeping every night, they have to clean their face. Generally, children are very lax with their at that stage with their hygiene, or maybe even the hygiene is good. They don't wash their face before sleeping. So that is very important. Every night, the face has to be washed so that the dirt on the face is washed off. And after this, of course, you should consult a dermatologist. There are some medicines which can help in getting rid of these acne.
Okay. And what about when it comes to the counseling on done on part of parents, because they are equally stressed?
Oh yes, please don't do that. Please, when your child is stressed, do not get overstressed. What you feel and what you project in front of your children is what they would start feeling. You know, So you have to be very calm and please don't bother. It will all settle down. It is not a permanent thing. Acne is a very small problem. That time it feels big, but generally, it's not such a big problem. So you have to just consult a dermatologist. It's very easy to get rid of teenage acne. Please do not panic, and please do not panic in front of your children, no matter what.
Right, right. Dr. Malhotra, could you please tell us some general tips one should include in their, skin and hair care regime that can be easily done at home?
Okay, so let's start with skin. First of all, every morning use a sunscreen. Number one, it's very important. Have a healthy diet, keep your bowels clean. I've already mentioned that. um, at night before sleeping, there are three steps you need to follow, which is cleansing, toning, and moisturizing. Always remember this, CTM. You have to clean your skin with a good face wash or a scrub. Then you have to put a nice toner. Toner tightens the skin, tightens the pore, and gives you a nice glow on your face. Third is moisturizing. Use a nice moisturizer which is chemical free. Cetaphil is a good company to use. The moisturizers are fragrance free and they are chemical free. So this is a routine thing which you can use. After maybe 35, 40, you can use anti-aging creams at night time. Vitamin C serum is something which I advise to a lot of my patients. Vitamin C serum has no side effects. You can use it every night before sleeping, before putting your moisturizer. That also gives great results. And of course, manage your stress. Then there are certain homemade packs, which includes besan, multani mitti, chandan powder. Add some nimbu to it. Lemon is a natural bleaching agent. Add some honey to it. Honey is a natural bleaching agent. Add some milk or malai to it, and just apply it like every alternate day or every day also for about 10-15 minutes. That also does wonders.
Okay.
Um, you can break an aloe vera piece from your flower pot at your house and just rub it on your face. That is a very quick thing, that also gives a nice glow. Once, okay, consistency is the key. You do it for a day or maybe a week or two and then you expect results. No, be consistent with it. Do it every day or do it every alternate day and you will definitely see results in a month or two. If I put it in a nutshell, self love should become a part of your life, so this
Right.
is a part of self love. It's very important. Now, coming to your hair. For your hair, of course, diet is very important. No matter what you do, if you are having a nutritional deficiency, your hair will be brittle and rough. Number second is do not use some any harsh chemicals on your scalp. Do not use shampoos which are rich in ammonia. So ammonia free products should be used. Do not dry your hair very frequently. So curtail the use of hair dryers. If you have to use hair dryer, use dryers at medium heat, not high heat. So there is cold, medium heat, and high heat level. So medium heat is
Yeah.
a good option. Then, if you have to go for chemical treatment of your hair, you can go for chemical treatment once a year. And once you go for a chemical treatment, start taking multivitamins 1 month prior to the treatment and 2 months post treatment. Multivitamins which are targeting your hair roots, like your biotin, calcium, vitamin D. So there are a lot of multivitamin tablets which your dermatologist can suggest to you. You can start a month prior and 2 months later than the treatment. That prevents any hair fall which happens with these treatments. Go to
Right.
a good parlor, don't go after rates, go after good products. So when good products are used and which are backed up by multivitamins, then your hairs withstand that trauma very easily, and then you can go for it once a year, once in 2 years.
So you talked about chemical treatments. There are, I think, multiple Brazilian treatments in the market right now. There's keratin and straightening and whatnot. So is it really worth it? Putting hair under that much stress with all those chemicals piled on.
Well, if you would ask me, frankly, no. Do not, ideally, you should not touch your hair too much. But, when it starts affecting your mental state, when there are people who are so obsessed with the way their hair looks. Like if you have straight hair, you're obsessed with curly hair. If you have curly hair, you're obsessed with straight hair. And then you start comparing yourself with others. Then somewhere, if it affects you mentally, then one can go for it with proper precautions. Okay, so I would also like to say few things about people who dye their hair, because invariably everybody dyes. Graying of hair is a very common thing which is
Yes.
happening in even younger generation now. Uh, I would suggest that you go for plant-based dyes. Okay, there are certain companies. I don't know if I get. So there is something known as vegetal dye. These are vegetable-based dyes. So, or in this value, there are certain companies, you can just Google them, which have dyes which are extracted from plants. So these dyes are ammonia free, chemical free. उनका effect उतना strong और उतनी जल्दी नहीं आता है, लेकिन decent आता है. So that is totally safe for your hair style.
Could you please repeat the name of the
So there
plant
are two
based?
companies. There are two companies which are good companies. One is Vegetal Dye, Vegetal, and second is Indus Valley Dye. So these
Okay.
are two companies. You can try these colors. It may be not that much gratifying, but it serves the purpose. Okay, and it
Right.
keeps your hair safe.
Okay. Okay. Dr. Malhotra, my last question to you is: are there any treatments for graying of hair? What possible treatments are there?
Well, there is no treatment for graying of hair. I want every all of you to understand this and be aware of this when you ask a lot of doctors or you discuss amongst your colleagues and all. People will come up with a lot of options, solutions, and all. Please let your hair be, because once they are gray, they will be gray. You can only color them and give them an appearance of a black color, but you cannot treat them and you cannot reverse the process unless and until it is due to some underlying disease. But natural graying of hair, which can occur even early in life, it is when it occurs in teenagers and in 20s, then it is mostly genetic. You cannot treat it, you have to live with it. And nowadays, people go for deliberate streaking of hair with white color. It's in fashion nowadays. So
Yes.
why not adopt that salt and pepper appearance and enjoy it, rather than fighting with it and trying to reverse it when you really cannot do anything about it.
So I think coloring your hair would be a much more viable option.
Yes, absolutely.
I think it was a wonderful session, very informative, and something that our audience must have related on every single level. We tried our best to cover all the possible awareness questions that we could, and every information that was shared by our expert, I think that was very valuable and very much used to the audience as well. So I really thank you, Dr. Malhotra, for being with us today, for taking our time and sharing your insights, your expertise on our platform. Thank you so much.
Thank you, Dr. Dravya. It was an absolute pleasure to be here. Thank you.
Thank you so much. Namaskar. Thank you so much for joining us today. Tell us in the comment section how you liked our today's episode. Leave us comments about your questions, thoughts, and feedback, and our expert will get back to you. Do catch us live next week on Thursday at 6 p.m. on YouTube and Facebook. For regular updates, stay connected with us and subscribe to our channels. See you next week.